There we go. Perfect. Kate, you want to start it off and do an introduction of who you are?
Hi, I'm Kate in BRCA2. I found Tracy when I started my journey, and I've been alongside her doing all these events and Zoom calls for like 2 years now. So if anyone wants to reach out to me, you'll see me all over the page. So I'm just sitting here on my balcony because my boyfriend's watching the Heat game right now. So
Perfect.
all right.
Allison, do you mind doing a short introduction?
Sure. So I'm relatively new to this. So I'm actually going into the field of genetic counseling, and I looked at my own family history and talked to my dad. And so about a month ago, he tested positive for BRCA1. So my sister and I are kind of on that path of deciding of everything. So it's still pretty new things. So yeah.
Thank you for joining. And if there's anything that you need or anything that we can help you with, let me know. We'd love to assist you any way we can. We do have a private group on Facebook. You can feel free to join if you're not already in there. And then on Instagram, we're constantly doing educational calls, for all levels of our journey, because we all begin somewhere. So thank you for joining us, and we're here to support you.
Thank you. Yeah, I appreciate being in a group here.
Thank you. Elizabeth?
Hey, I'm Elizabeth. I'm from Maryland, 35. I was diagnosed with BRCA2 last November. I completed my hysterectomy BSO on August 4th, and I'm going in for my prophylactic mastectomy and deep reconstruction on September 17th.
Thank you for joining, and we appreciate all your support and definitely coming on all the calls. Lisa?
Hi, I guess it was April of 2019. I tested positive for BRCA1 and check 2 actually. Had my hysterectomy in July of last year, and 5 weeks ago had my preventative mastectomy, bilateral mastectomy.
Thank you for joining.
Thanks.
Wendy?
Hi. My name is Wendy. I am from Chicago, Illinois. My cousin is here to support me. I'm having surgery tomorrow. I was tested positive for BRCA1 gene 3 months ago. So now tomorrow I'm having bilateral mastectomy with deep flap. So I'm just having a day. Hopefully I'm gonna get through this. It's all good, but I'm a little nervous tonight. So I'm glad I'm here.
Thank you for coming. Love talking to you today. You can pick up the phone and call me anytime.
Tracy, you're the best.
Thank you. Let's see. Tammy.
Hi, everybody. I'm Tammy Ayon. I'm in South Florida in Hollywood. That is my cousin, Wendy. And we're talking genetics. We have the same exact BRCA gene. I'm ovarian cancer survivor, a 2-time ovarian cancer survivor. I had a full hysterectomy after my second diagnosis. First diagnosis was at 19, and had a bilateral mastectomy with deep flap reconstruction and many complications. But I'm here, and I'm happy to be part of this wonderful organization and all that good stuff.
Well, thank you everybody for coming and taking the time to introduce yourself. I'm Tracy Milgram-Posner, the founder of BRCA Strong, where we educate, inspire, advocate, and support survivors, and thrivers to eliminate the feeling of isolation and help you feel whole again. You do not have to carry a BRCA mutation to be part of our BRCA Strong group. We're here to support everyone. Tonight we have a special guest, Julie Simon, a genetic counselor on tonight. And what I'm going to do is pass over the mic to Nikki, who I connected with on social media and presented this amazing opportunity to come on tonight to educate our community with genetic counselors. Often I would say, maybe Julie could give me a better number, we are misguided and not given genetic counseling or even seeing a geneticist. And I know that in one part of my journey, it was missed and waited till many years later. So I'm interested to hear tonight and appreciate you guys coming on and sharing your information in your platform. So maybe Nikki, if you just want to come on and do a short intro again of who you are for those of you who weren't on before.
Yeah, hi, thank you. My name is Nikki McCoy, and I found out about my BRCA1 gene mutation in May of 2019. I had my prophylactic BSO and supracervical hysterectomy last September, and like a few of you on the call today, I am up against my upcoming prophylactic mastectomy and reconstruction on September 24th. So that's all exciting, right? Like we're here because we want the knowledge to make the right decisions for our long, healthy lives. So since I received that diagnosis, I began actually working with the nonprofit that helped me through my counseling and my testing. And that organization is called the Genetic Support Foundation. So I help with their communications and outreach, and Julie Simon, who you'll meet here in a moment, is one of the genetic counselors who helped me along my journey and who's going to talk with you today. But yeah, feel free to ask any questions at any time. And of course, I'm in a lot of these groups. I met Tracy through Facebook, and you're right, I definitely need to be getting on Instagram more often. But it's just wonderful to see this type of support for people in our situation. So thanks for having us.
Perfect. Thank you so much for coming on and sharing your own personal journey and, guiding other women. So with that being said, Julie, I'd like to pass the mic over to you. Thank you so much for coming on tonight and giving us the time to educate, these women, and to the listeners that go onto our YouTube channel. Knowledge is power. And again, I feel like genetics is a huge component, and either many women are diagnosed and just sent down to the breast oncologist, not at a center, at a private setting. I could say especially, we're not sent to genetic counseling. We're not sent to, go see a geneticist. It's kind of crazy how the field works. If there's no right or wrong, it's here's your diagnosis, move forward. It's not here's your diagnosis, let's see this person and this person so you make the right decisions or your path. So I'm super grateful and thankful for your time tonight.
Yeah, well, thank you, Tracy, for having me here tonight. Thank you all for sharing your stories. It's really, it's nice that you guys have this opportunity to hear from different experts. I've been watching some of the old YouTube videos today, getting ready, but it's nice that you have these resources. And like you said, not everybody does get referred to genetics, either a genetic counselor or a geneticist, or has the opportunity to meet with someone on their team who's familiar with genetics, even if they haven't had the formal training. So I'll tell you a little bit more about myself briefly, how I got into this, and then my plan is to kind of talk through some of the main points of what having a genetic mutation or a genetic variant means for you and other family members. I want to make sure we have enough time for questions. And I'm actually on the West Coast, so I have plenty of time to stay late if we find the conversations just flowing. But I do have some points to hit, some slides if you're a visual learner like I am. And I have been in this field now for 10 years. And it wasn't actually until I decided I was going to get into genetic counseling that my family told me they had previously met with genetic counselors. So my maternal grandmother had breast cancer at 38 and passed away at 41. And I come from a family who opted not to get genetic testing. So they were one of those families who were lucky enough to meet with a genetic counselor. And apparently my mother met with one multiple times before she decided to share that, but then decided that they didn't want to know. So that's part of what my job is if I meet with someone before they've had the testing, to kind of work through what those options are. And so like Nikki said, I work for Genetic Support Foundation. We're a nonprofit based out of Olympia, Washington, but we see people across the country. And I'll kind of touch on this a little bit today, but that's one of the advantages of working remotely and having telehealth, and we've been doing this for years now, is that I can meet not only with you, but with family members. So if you're coming in for your appointment, but your daughter, your sister, your niece, any of your family members have questions and they're available, they could join in a call just like this and have that appointment with you and hear all that information up front. And so at Genetic Support Foundation, kind of our whole goal is to get information to people, to their families, in a non-biased way and in a supportive way, so that you have all of the information that you could need or want to make the decisions that are best for you. So hearing from your introductions and going through the videos, it sounds like most of you have already had testing, hopefully have heard of a genetic counselor, but like Tracy mentioned, that's not always the case.
It's interesting. My mom's on the call. I'm BRCA2 positive. My mom has multiple myeloma, and she's actually on the call to hear more about genetics because it caught her attention, like you said, like family dynamics, different kinds of things. So I know she's eager to hear some information. And like you said, about her interest is never to get genetic testing. So I just wanted you to know there's obviously a couple different people on the call. We did have one new member. Maybe before you start, if we could just let her do a short introduction so we can maybe have her history too to understand.
Oh, absolutely.
So it's going to be, my mom supported me my entire life of my journey after I was diagnosed at 21 and I'm 37. So there's definitely some mixed feelings. So there's other people on the call. I just wanted to give you the heads up, but she's not against it. So, so if Jacqueline, if you don't mind, welcome. Thank you for joining. If you don't mind to just do like a short introduction, just so we can welcome you to the call and we're all familiar with you.
Yeah, I'm sorry I'm late. I was having some difficulty getting my phone to connect. So my name's Jacqueline Gwynn. I guess long story short, October of 2018 went into premature ovarian failure. So I just kind of stopped having menstrual cycles. I was having hot flashes and menopausal type symptoms. I thought maybe I was pregnant. After a couple of weeks of that, I went and got seen by my provider, was diagnosed with premature ovarian failure and still unsure why. But I did seek out genetic testing on my own because I do have an extensive family history of ovarian cancer. I have 4 female relatives on my father's side that all died from ovarian cancer. So I requested the testing, and I ended up testing BRCA1 positive last year. So I had a BSO and total hysterectomy, as well as my prophylactic mastectomy in June and July of last year. And then I had reconstruction in October. So I'm kind of on the outing end of it now. I'm also a nurse practitioner and I work in family medicine. So I've since really tried to provide education to my female patients and let them know about genetic testing. And I do genetic testing in my office now. So just kind of here to get more general information as well.
Perfect. Well, thank you so much for joining and sharing your story. Okay.
Yeah, thank you. And if I see more people jump on, we can pause to let them introduce themselves or wait till the end. I guess I can leave that to you, Tracy.
Perfect. Thank you.
Okay. Yeah.
I shared your screen. You said you had some PowerPoints, right? I just want you to know I gave you permission to share.
Oh, thank you. Yeah, and I'll jump back and forth because I'm a big believer in if you could just read the slides and I don't need to be here, then that's not the best PowerPoint option. But especially, I myself am a visual learner. I need to see things before they really make sense, and that might help others who weren't able to be here live. Might answer some of the questions they didn't even know they had yet. And so I'll jump back and forth between those, and I'll go through some of the basics, and then maybe pause for questions at that point. And if no one's jumping at questions, then I'll go back. I have some different stories and other information to share as we have time for. So I guess I'll start with what a genetic counselor is and what we can do, kind of where we can help. And so we are a group of healthcare professionals who have a graduate degree in genetic counseling specifically. So it's a mix of all of the science of genetics along with the more the art of making that information understandable and available to people. So I often describe it as being an interpreter between you and the rest of your healthcare team, mostly physicians, and trying to help you understand what all of this information means for you and for your family members, where you are now, and then where you're going. So traditionally, we would have at least one appointment, whether that's in person, face-to-face, or like now, most of the appointments are over video or some type of telehealth equipment. And what we'll do is we'll go through your own medical history and then collect all of the family information. So actually draw out a full family tree of all of your family members, who has had a cancer diagnosis, who has not, and if anybody has had genetic testing yet. And ideally, we would get a copy of those results. So I know we have a couple different families represented here on the call, and some of them know they carry the exact same genetic change, and that's helpful for us to make sure we're getting you the right information. Like we've also heard, it's also possible to test positive for more than one gene. So it's helpful for us to know if there's other genes that have been tested for, or other genes that have come back positive in a family, again, just so we have all of that information so that we're being as specific as possible for you. And then we'll go through the results themselves. So if you've already had testing, what does the result mean? We can work through the report. We can work through the kind of the outcomes. So a lot of you sound very familiar with the surgeries, and I don't know how much of that was from good conversations with healthcare providers versus doing your own research, or some mix of those two. But we're here to help wherever you are in that process. And then deciding if there's anything else that we could be doing for you. So if you're BRCA positive, are there other screenings that haven't been brought up yet, or that were put on the back burner during a cancer treatment that we need to bring forward again? So kind of taking that step back to look at you as a whole person and a whole family, and make sure that you're getting all of the different screenings and recommendations that have come up over the months or the years, and that nothing's being forgotten or falling through the cracks for you. And so as you can imagine, that's a lot of information to cover in an appointment. So we usually schedule about an hour. For some people, that's enough, and then we can follow up by phone or by email. For other people or other families, they need more. And so we'll do follow-up appointments. Sometimes that's the time to bring in other family members to have their questions answered, and kind of check in with you on a semi-regular basis as there's any updates with these genes and with these recommendations. And so let's see if I can go back and forth here. There we go. So this may be familiar, but kind of, looking at this in the larger picture of somebody who themselves has had a diagnosis of cancer, or a close family member. Of all of those people who have been diagnosed with a cancer, only about 5 to 10% of the time will they fall into one of these genetic or inherited cancer conditions, like the BRCA1 and 2, where for most people, they're actually going to fall in this, what we call sporadic or random group, meaning that there is no known cause or one single test that we could do to explain why that cancer happened. Then there's also this other group of familial. So people who have lots of family members who have had cancer, but all of their genetic testing has come back normal. So we're still very suspicious that there's something running through that family. We just haven't been able to find it yet with technology. So we're finding more of the explanations in this group, like the CHEK2 genes. We've only been testing those the last, goodness, it's been maybe 5 or 6 years now that it's been more routine. But especially the last couple years, if someone's had genetic testing, it likely included some of these other genes in addition to the BRCA1 and 2. So that's the small slice. The inherited or genetic is where I was going to focus tonight. And looking at that, it can have big implications for families. And so, again, that was kind of where I was going to focus tonight, is now that someone has results, or we're suspicious that there is one of those genetic forms, what does that mean for everybody else in the family? And so for the vast majority of genes that can cause breast or ovarian or other types of cancers that run through the family, they run through families in what we call a dominant pattern, meaning that if a person carries it, it's a 50-50 chance that they would pass it on to their children. And that has to do with how our genes are actually transferred to kids, or how they make up our bodies. So we all have 2 copies of our genes. We get one from our mother's side and one from our father's side. So with these genes, if you're BRCA1 or 2 positive, that means one copy of your BRCA gene is turned off. It has that mutation. It's not able to work right. So it's not able to do its job and protect those cells from developing cancer, where the other copy still works just fine. So it's still able to jump in if it sees a cell that's growing out of control or starting to form that cancer, and it can still turn it off and do its job. But something can happen over time that turns that second copy off. So when you're thinking about passing this on to family members, we're looking back at the situation where you have one working copy and one non-working copy, or the one with the mutation. When you go to have children, you pass on either one. It's 50-50, it's completely random. There's nothing that you could do to intentionally pass it on or intentionally not pass it on. And so this is where we start to get in that question of family dynamics. So like Tracy had mentioned with her mom, with my own family, not everybody wants to know. So the technology is out there, but there's different reasons why somebody may choose to do the testing or choose not to do the testing. So my inclination or my bias being a genetic counselor would always be toward more information, but that doesn't always mean testing. So as long as you've had the option to sit down and work through what the genetic testing would mean for you or for family members, that's all that I would ask. And for some people, it's the knowledge to say, no, I don't want to know, or I don't want to know right now. Maybe I need to go home and talk to a partner, talk to a spouse, talk to a parent, and decide if this is the best option for me, and then come back at a different time for the testing. Same with getting results. So again, I know a lot of people here have already gotten results. That's how they're getting connected to the group. But you have the option of when to get those results back. And maybe you were totally gung-ho for the testing last week when I met with you, but 2 weeks from now when the results come back, maybe it's not a great time. You're not feeling well, a family member just got diagnosed, you have 3 kids who are trying to figure out school right now. You know, whatever it is, we understand there's things that go on outside of our appointments. And so giving you that option to decide when you want to learn the results, I think, is another important piece of this. And then once you have the results, what does that mean for everybody else? So as a genetic counselor, I spend a lot of my time putting together resources and letters for family members. So people who I usually have not met before, I've never interacted with, but we're trying to get this really complex information out to all of the siblings, to the children. Maybe it's more distant family members, aunts, uncles, cousins, in a way that makes sense, that only shares the information you want to share with family members, but still gets enough for them to be able to make that decision. Like, for example, I met with a gentleman recently. He has prostate cancer himself. And when we started talking, it turned out that his sister had previously been diagnosed with breast cancer. And questioning him further, it turned out she did have genetic testing already and she was positive. So if I remember right, she carried a BRCA2 gene change, but she was clearly positive. She had shared the information with him and he just was reluctant to do the testing. Wasn't going to change anything for him. He didn't want to know. And he had 2 daughters. And so as we were going through the information in the appointment, it turned out he was feeling really bad about the fact that he could have passed this on to his daughters. And so it was more his feelings of guilt keeping him from wanting to know the information or wanting to do the testing. But when we went through what his daughters could do with that information, you know, as far as knowing if they themselves carried this same BRCA2 or not, giving them the option to do preventative or the prophylactic surgeries and kind of really empower them to make decisions. At that point, he opted to do the surgery to kind of to do the testing to give them the information they needed. So it opened doors for family members, but we had to start with that conversation. So we had to get the family member in the door first to kind of work through all of the pros and cons of doing the testing. And then, we have others in the group who are previvors, so who have not had cancer themselves. And part of my job is kind of working through what those surgeries look like and why someone might want to do a surgery now versus later, kind of, again, looking at all of the other things going on in their life and how this genetic result might change those decisions and the timing of those decisions. Okay, I think I'm going to pause there so I can get a drink of water if we have any immediate questions.
What is the appropriate age, when you're talking to family members? Like my cousin and I both, we're both mothers, and I've had ovarian cancer. She currently has breast cancer, and we both tested positive for the gene. But what is really the appropriate age as far as testing for children? My diagnosis of ovarian cancer the first time was at 19.
Right.
So do you test before 18? What's the process, and how do you handle that with children?
Mm-hmm. So that's a great question, and I'm sure a question that comes up a lot for many people. Ideally, we would wait for the testing until the children in the family are adults themselves. So I would usually say late teens or early 20s, or when it would change what we're recommending for them. So with you yourself, Tammy, having an early diagnosis of ovarian cancer, I would have your kids come in at 18. We don't have great guidelines about people who have been diagnosed with ovarian cancer that young and what to do for their family members. But at least for your kids, they could come in and have that conversation right away to, again, decide if this is something that they're interested in and outline what types of steps that we could offer for them. Because a large part of not testing children, especially little children, is there's nothing that we would do differently for them when they're younger. So it's not going to change what I'm telling the pediatrician to do. I'm not going to start, mammograms in their teens, things like that. But I have met with a few more mature teens, so 15, 16, 17, especially from families, like you guys, who have a lot of the information. You're well informed. This has been something that's part of the kids' lives, maybe as long as they can remember. They've always known that this is something in the family. So sometimes for those teens, I'll meet with them before 18 and have that conversation and just see what they think. And, for a large part of that, it does depend on you as the parent to tell me who's mature enough to come in and have that conversation. Other times it's the kids are coming into the appointments before we're ready to test them, but so they can start hearing that information. The other side to that, separate from how it could help the kids, is trying to not harm the children. So the different groups out there who make recommendations for children have decided it's not always helpful and potentially harmful for the kids if we do testing when they're young. There's the possibility of finding out they're positive and then treating them as if they're sick, even though it's not going to change anything that we're doing for them. They don't need different treatment when they're younger if we know they're positive. And so trying to hold off on that, either from someone who's taking care of them, a parent, grandparent, other family member, teacher, or for the kids themselves. When you're younger, you're not always able to process more advanced information. And so the kids, if they know they're positive, they start not participating in activities they otherwise would, or they're more timid in their whole existence and going through life, and they don't have the option to have that childhood without the burden of the knowledge of the genetic change.
So I have a question. Tammy, you have another question? So I have a question, and so I never had the chance of having genetic counseling when I was diagnosed at 21. It's maybe one thing that you can explain is maybe the benefit of using a genetic counselor and using a platform like yours. For example, from what I understand from what you're saying is basically once you're diagnosed, you go over the options, the preventative options, your treatment options. Most of us just focus when you're BRCA1 or BRCA2 on saying, you need a prophylactic bilateral mastectomy, you need a hysterectomy, but nobody talks about your pancreatic or your skincare or any of the other physicians or dental, right? Dental's never spoken about. When do you ever hear about dental and BRCA? never, but if you take preventative action, it does affect your dental.
Oh, I didn't know that.
Oh yeah, your gums, your bones, it affects everything, your jaw. So, and then you have to go on a medication, right, for osteoporosis that now hurts you because it doesn't work in your favor with your, your jaw bones. So maybe you could explain on like the benefit of why somebody who's either a survivor, just diagnosed ovarian or breast or BRCA, like what the benefits of us seeking a genetic counselor would be, where maybe from this video tonight, we can get the word out and share and express more of like, seek a genetic counselor because these are the benefits and this is what's going to help you, instead of us kind of like drifting and going our own way and saying, this is what we need to do and being our own advocate. Maybe there's more of like a couple lines you can share with me.
Right, right. Well, and like you said, genetic counselors can get involved at any stage that somebody's in. So sometimes I do meet with women right after their cancer diagnosis, and we're mainly going through what the testing is going to show for them. And if it's BRCA positive, then your surgeons are going to talk about these more involved surgeries like the mastectomy versus a lumpectomy. Sometimes it's the surgeon who's doing the genetic testing, and they'll refer back to us after the results have come back positive and after you're through treatment is, I would say, more often when I'm meeting with people at that point. And then the advantages are helping understand the results. You've had the whirlwind of the diagnosis, the surgery, the treatment. So let's take a moment to sit down and breathe and actually process this information. We can also help advocate for you. You don't have to do all of the work yourself. So making sure that you're connected with all of the different healthcare providers who would be available in your area. So maybe you've hit all the big ones, the oncologist, the surgeon, the radiation oncologist, but maybe you've never met with a social worker and you're having a hard time with bills. Or you haven't met with a lymphedema specialist and you're noticing a lot of swelling, and maybe physical therapy could help. So kind of connecting all of those different resources that are out there that you may not have just come across yet in your own research and your own planning. And then also working through the conversation of how to tell other family members. So this could be before or after a cancer diagnosis. It's overwhelming enough to learn about your own medical information, your own diagnosis or chance of getting a cancer, and then to turn and take that and try and tell other family members and answer their questions when you're still trying to understand it yourself. So kind of getting a plan together for talking to other family members, or maybe working through what that conversation would sound like between you and your aunt who really doesn't want to know, or your uncle who has an opinion about everything, including what type of breast surgery you should have. Is that their place to have the opinion? Well, that's between you and your family, but we'll give you some different talking points on how to deal with those people. Maybe you come from a small town and you just don't want to tell people yet, because once you tell one person, and everybody's going to know. So kind of dealing with those more muddy issues that aren't so clear cut, like you have a breast cancer, I'm going to recommend surgery. We take this step back and look at that bigger picture. And then if we're, for any previvors who are in the group, it could be the opportunity to talk to their OB/GYN or their primary care doctor about what screening is going to look like. Say someone has decided not to do surgery. How often should they be getting the mammograms? You mentioned the pancreatic screening. Make sure somebody's doing a skin exam for you. So hit all of the more commonly known things in healthcare, and then some of the more nuanced or not as well understood facts by other providers.
So you said like you've helped like your patients write letters to their family. Like, do you have one maybe that you could share with BRCA Strong that we could like share in the group? Like obviously with no names and stuff, just to like, cause so many women say like they're alone, right? Like, and Nikki, you could even share it if you wanted it from in the BRCA Strong group. Like so many women say they're alone, or they feel alone, or they don't know how to tell their family members, or there's family that they don't talk to. Like, maybe just give like an example to let people know, like, this is another avenue, right? Like so many of us stress, oh my God, we got the gene. Like, what are we going to do? Who are we going to share it with? How are we going to share it? But like, letting them know that like this is another option if you don't want to get on the phone, if it's too much detail, like here's what it is, take this information and go, you know. I don't know
Yeah.
if that's too much to ask. We totally
Oh, no, not at all. I'm trying to pull it up. Oh, there it is. Okay. So this is one of the more generic ones that I would share with people. It kind of just highlights why an appointment might be helpful for you and then why testing might be helpful. So it does break it down into those two different groups, depending on, again, where someone is and what they've already had done. The other advantage of having the full appointment is I can easily send this to anybody, especially if there are some different family dynamics and they're not as close or they don't share personal information with family members. It gives them a very generic option and something coming from a healthcare provider, which might be more help to them. Where if, if I've met with you and you've explained more about what's going on in your family, specifically what those different problems are, then I can help put together a more specific letter, either for a family member or for a whole, side of the family, to get that out, based on what you've already had going on and kind of how your family prefers to get information. And I can also help people write the letters from their point of view. So let's say, Tracy, you wanted to send out the letter to all of your family members. I can give you the language to put into the letter, and then you can edit it and make it your own for something that would work better for your specific family if this generic template just doesn't work for you.
Okay.
And then it also includes things like other support groups like this one, books to read, kind of different areas depending on how family members like to get information or like to do their own research. It gives you different places to go to start that journey.
Okay. Does anybody have any questions so far?
I think I saw Toby had her hand up.
Toby, go ahead. Toby. Mom?
Hi, is there specific testing? I kind of have my head in the sand when it comes to doing genetic testing for the BRCA gene. That's my own personal journey. I choose to stay away from for some odd reason. My brother's gone through it. He came through negative. It's just who I am at this stage of my life. Is there specific genetic testing for multiple myeloma?
For multiple myeloma, there's not great genetic testing. So there are a few conditions, not usually BRCA1 or 2, but a few others. If, without knowing your full family tree, if there's other family members who have had multiple myeloma or other of the similar blood cancers. There are a few rare types that we can see, but generally most of the multiple myelomas or leukemias or lymphomas tend to be more random and something or a group of some things that happened over your lifetime that eventually led to that myeloma starting.
Okay, nobody ever said that to me. Okay, then I really thank you for that.
It's interesting, like I'm BRCA2 positive. My mom has multiple myeloma. Tammy is BRCA1 positive and her mom had multiple myeloma. So we always come about like, is the BRCA, related? But obviously, I mean, as I can say that I was diagnosed in 2004, right? That was 16 years ago. 16 years ago, BRCA was nothing. Like we couldn't even get on this call and have this conversation.
Right.
So I wonder, like down the pipeline, are some of these genes gonna somehow correlate? Like look, CHEK2, PALP2, right? These are all becoming discovered genes. So I wondered if
It's just strange that like we have so many similarities in the types of cancers in our family. You know what I mean? And then both of our mothers having it, and then us both being. I'm BRCA1 and she's BRCA2, but.
Well, it's also possible, like Tracy said, that we will down the road figure out that, yeah, BRCA1 and 2 do go with a slightly higher chance of getting multiple myeloma, and it just happened for your families. It was always your mothers who developed it. And that's why we also encourage people to check in or join support groups so that they can learn what's new, what's the latest research. 16 years ago, we definitely did not know as much as we do now. We didn't test for CHEK2, ATM, PALB2, any of these other genes. You were lucky if you got your insurance to cover the testing back then.
So it was more, it was $3,000, and we fought them for a very long time. But I did not give up because I knew my family history. I wasn't giving up. I already knew what I was. So for me, after having 2 lumpectomies at 18 and at 19, I was not giving up. Like, one of my local residents actually reached out to me today and said, like, she can't get her insurance to cover it. I said, you need to call me because your insurance will cover it. Like, bills, like, I mean, I'm super educated on all of this because of my own personal journey. And I was diagnosed, pre-Angelina Jolie. So there was no publicity. There was nothing out there. Christina, none of them were out there talking about their journey. So it's interesting how it's all changed over the years, and like genetic counselors and all this stuff has come to the head. One question that I do have, and we get a lot, is, are there any platforms, like we've worked with My Gene Council, I don't know if you're familiar with them, but like any platforms that we can join and belong to get updated information. Like, I know you can go on NIH, and you can go on like all the studies and the places, but a lot of these other women don't know these resources. So if there's any apps or platforms that you know of, maybe that we could benefit from, I'm not sure if you know of any.
So I'll be totally biased here. We have a patient library on our website that has updated information. Some of it's more generic, so something that would be good to send either newer members or family members to. And then we do keep part of the research and support groups up to date as well. So as there's new reports coming out, we try and update our website to reflect all that and make sure it's more accessible, it's easier to read, it's not all written at a PhD level. And then I could, along with the template letter, I could send along some of these other groups that we use to look at them. And I hope it's not too loud on your end, but there's the dogs going.
We know who's home, huh, Julie?
Yeah. But there's different resources that would answer that question. Some of them are at the more scientific or medical ease side of things, and some of them are more patient and family friendly language. And what about, I saw Nikki just put the link to our website in the chat there.
Perfect. Thank you. What about, I know there's a couple moms on the call. I don't know if anybody's open to hearing this, but I'm going to ask the question. Like Tammy talked about, like, when is it appropriate to screen? Like, my kids are educated on it, right? Like, my daughter knows everything. Like, her comments come out all the time. Well, I'm 50% a chance. It's like, but when do you, or not when do you, like, what kind of resources do you recommend for our children? Not like mommy's going in for a mastectomy or a hysterectomy, but like genetic family tree information that we can like sit down and explain. I read an amazing book, Proactive Genes. It's a fabulous book, but it's for little kids. Now my daughter's getting older, and as questions come up, like, I want to make sure that I can answer them correctly.
Right. And how old is your daughter?
11, but she's been part of my, she's the reason I have BRCA Strong. She's my logo, why it's created. So she's always been like a true, part of it. So for her, making the comment the other day, like it was nothing, and I was stunned, and I said to my better half, and he's like, why are you surprised? She listens. And I'm like, but does she really understand? Like, her comment is, well, when am I going to get tested? Well, you're not going to get tested for a little bit. Like, let's slow down. I knew younger, but again, technology's changed, but there has to be stuff out there that, and maybe some other moms can relate, is like talking to their children about hereditary.
I have to just jump in real quick, Julie. And that was like one of my first and main concerns. I was like, after getting my results from Julie, I was like, help me talk to my kids. You probably saw the big one walk by. He's almost 15. And then I have one who just turned 11. And it really does change, whether or not you're talking to a 10-year-old or a 15-year-old, or, what a conversation that starts, when they're in elementary school is totally going to be a different conversation than when they're in high school. So I'm glad you asked that question, because I'm kind of there. My kid totally made this joke the other day. He was like, I said something about, I don't know, his humor. I was like, he got that from me or something. He's like, better than the cancer gene. And I was like, oh, but that was, but he uses dark humor to kind of process, but but little comments like that, you think, well, how much are they really thinking about this? Like, how much does it kind of affect them, and how much are they understanding? So I just kind of wanted to chime in for my own experience there, and also say that Julie probably has some good information to share next.
I think it's important, that we talk about like the future. Like, we don't know what it's going to bring medically, or clinical trials, or what's going to come out, or the vaccines that they're working on. We don't know, but it's like, in the meantime, where's that? Like, I have a 7-year-old and I have an 11-year-old, soon to be 8. Like, he doesn't really ask as many questions. She does, but you never know when those questions can come, because they're part of what I do.
Mm-hmm. Well, and especially 11, I think, is a hard age, because they're learning so much. They're asking all of those great questions, but their brain just hasn't developed to deal with the larger issues. They're still at the point where it's an all or nothing type of mentality a lot, that if I get this, I'm definitely gonna get cancer, I'm gonna get sick. Like, it can spiral out of control very quickly. But there are a couple different resources. There's not a ton for younger family members, so for kids or that tween teen age. But some of the ones that I would look at there's the Marie Keating Foundation. As soon as I have a second, I'll send links over. And so she has a page specifically about talking to older children and teens about BRCA and about it running through families. Force has a page dedicated to talking to family members. And then Kin Talk is another group. So it's kin, K-I-N, like a family kin.
Mm-hmm.
And that one, there's some information available just without signing up, but it's in, I've lost my words. They worked with a genetic counselor to put all that information together. And so it allows you to log in and sign you or your whole family up. And then they have resources like our template letter here for talking to adult family members, but also talking to children, and kind of how to answer questions at those different developmental stages for children. And I think one of the other important pieces, no matter how old the kids are, is to not lie to them or oversimplify, which is a really hard balance as a parent. But kids do pick up a lot. They understand more than they might let on to. And it's knowing your kids and how they like to take in information. So maybe for some kids, it's a whole day and they like to be the center of attention. So they know they have your undivided attention that day, and they can ask all those questions, and that's a safe time and a safe place for them. Where other kids might not be the most vocal. So they might appreciate having a friend or having a sibling with them so that they can hear the other questions. They can absorb more without being put on the spot, where they might not be comfortable and they might not ask those questions. And same, especially for the older teens and young adults, they might appreciate an appointment with their parents. More often, they appreciate an appointment without their parents, so they can ask the questions that you've probably been telling them for years, but they don't want to re-ask, or they want to ask without that relationship there. They can ask someone like me that they've never met, they're probably not going to meet again, and we can have those candid conversations without all of the history and the love and affection and everything else that you provide for the kids. And that's true whether they're 5 or 6 or whether they're 60. Families are unique and individual and special, and they're all different and they're all challenging. So what might work for one family member is not going to work for another family member, and that's okay too.
Right.
And the kids sometimes have the most pointed question, like Nikki's always shared with her son. They'll call you out if you've changed your story, or if maybe your emotion is changing how the information is heard for them. Even though you're saying the exact same thing, they might hear it 2 different ways depending on how they're feeling that information. I'm sorry, Tammy, I interrupted you.
Oh, no, it's okay. I'm listening to you. I'm just thinking about my kid and this whole process and my crazy family. So yeah, I'm listening to you. But I have another, just aside from kids, I know most of us on the call have dealt with ovarian, you know, have had hysterectomies or have dealt with that and have dealt with the breast surgeries and I don't really know what the tracking or whatever the right word is for pancreatic and skin, but are there any other preventative monitoring? Because we can't cut out our pancreas. Like there's a lot of things that we can do surgically for prevention, but for other types of cancer, are there other things that we should be consistently monitoring other than going to a dermatologist? Like Tracy mentioned teeth. I've never heard that before.
So it is kind of remembering everything head to toe, and that you're not just a pair of breasts and a pair of ovaries. With pancreas, that's changing a lot. So I would recommend getting in with a GI doctor or someone who's familiar with pancreatic screening. Like in our area, we send people up to Seattle, even though personally I hate driving up to that area. They have a really excellent program for pancreatic screening, and they're doing a lot of trials. So especially for people who are more motivated, getting connected with one of them. So as we have some standard for pancreatic screening, they'll already be connected and set up. For skin, you mentioned, it's not just meeting with a dermatologist, it's also the recommendation to wear sunscreen or protect your skin, whether that's layers or hats, sunglasses, kind of just correcting what people have heard or what they've read on the internet about what good skincare can look like. So like, for example, I have very, very fair skin and I burn very easily. So I tend,
Me too.
I tend to just stay out of the sun. But if I'm going outside, I have full sunscreen on any place that's exposed, and then makeup on top of that. Because a lot of makeup products or lotions, foundations, whatever, they'll have the SPF in them, but maybe they're not as good as the straight sunscreen. So for me, it's sunscreen first and then everything else. And that's just an added bonus, which is what my dermatologist has recommended for me. And for others, it might just be, for their family, they're not somewhere that gets as much sun, or they're already always wearing layers because they're somewhere colder. So for them, that might not be the biggest part. The other thing is not forgetting about typical screenings like colonoscopies. So we recommend colonoscopies at 50 for everybody, but maybe you have a family member with colon cancer and we need to start you younger or do screening more often. That would be unrelated to the BRCA or to the CHEK2. So again, looking at everything else that's going on in the family to make sure there's nowhere else that we could recommend earlier screening or more frequent screening for you.
But like
for the, oh, go ahead.
Sorry, go ahead.
For
like the dental thing?
The dental thing, at least my understanding, I want to make sure I'm on the same page as Tracy, is that a lot of that comes from pulling the ovaries out and losing that hormone. So it's not necessarily BRCA specific, but it's specific to getting the prophylactic surgery or the full oophorectomy. So getting both ovaries out, you're depleting yourself of the hormones that are important for things like bone health, also heart health, and then less medically relevant, but things like skin and hair. So if we take your ovaries out at a young age, we throw you into menopause, your skin and hair are going to start looking more like postmenopausal women, even if you're in your 20s and 30s. So making sure somebody's looking at you as a whole person and addressing those issues as they come up.
Yeah, I'll just chime in to say that I now see once I told my dentist that I was in menopause and my gums were starting to bleed more and different things, that they asked me to please come in every 6 months versus every year.
Okay. My teeth bleed all the time. I didn't think that was I didn't realize, and they've been falling out, which I had a hysterectomy, but it never really, I don't know, I never put those two things together, you know?
That's what happened to me. I broke a tooth and my next tooth just fell out. And I was like, what? Then all of a sudden I've lost 3 teeth in the last 4 years, and I've had 2 implants, and my last implant failed because I don't have enough bone.
Well, and recognizing that that is something you need to tell your dentist, which again, who thinks about that? Like when you go to the dentist and they're like, any health changes? You're like, no, everything's been the same for the last 2 days because that's all I can remember right now.
Yeah, Kate, so, question.
You're on mute, Kate. Can we unmute her?
And I'm trying. There you go. Kate, go ahead.
You're muted again.
She muted herself. Are you touching it?
I'm cute. Okay, my hair's been falling out since I had my ovaries and tubes out in May of 2019, and I never thought that could be because of that.
Mhm.
I just thought maybe because I was getting older, I was 44 at the time.
Go get some.
And my teeth, every time they tell me to come for a cleaning now, I'm like, I'm not going near the dentist's office with COVID.
Yeah.
And my dad had lymphoma, and his mother died of pancreatic cancer. But I got the BRCA gene from my mom's family, and the breast cancer she and my Nana had. So
Okay. Now, and that's something else that we could do is for your.
actually, Sylvester wanted me when I found out I was BRCA. I went to Sylvester Hospital, and they wanted me to meet with the geneticist and all that. But I was like, no, let me do my surgeries, all my operations. And I never went back to meet with her because I was like, whatever, let me get my surgeries done with. And I never went back to see her. But they scheduled me with one, and I was like, whatever, who cares? I don't need that, because that's my attitude. But now I'm like, oh, no, I should have went back for that appointment.
Yeah, and you can always come back. So
Right.
There's no expiration on meeting with one of us.
Right.
Now, insurance and referrals and availability of appointments, that's all separate. But if there's an issue, usually you can reach out to the genetics clinic directly and they'll help you with whatever that issue is, because I can guarantee it's something we've heard before and something we've dealt with before.
Okay, because I was just like, oh, I'm done after those 2 major surgeries. I'm like, I don't want to find out about the other side of the family,
Yeah, and maybe
Right.
you don't want to know about the other side, but you have aunts, uncles, cousins who would.
Yeah, but
having-
my cousins on my mother's side of the family, my uncle doesn't have BRCA. My cousins don't have it, but me, my mom, and my brother do.
Okay. Yeah. So, and sometimes in families, knowing you have it where your cousins don't can change the relationships or how people get along.
Right.
Because everybody feels very different about that information. So we can get things like survivor's guilt for the family members who test negative. They actually feel bad that they didn't get the genetic change that's been running through the family. We can also get people who have guilt about passing it on, or guilt about being the one who tested positive but never had cancer, so had the opportunity to get appropriate screening and earlier surgeries, that type of thing. There's a lot of different emotions in the family that can come around the results. So same, a lot of people just assume that a normal result is good news. Well, maybe it's not for you, or maybe that's not the whole picture. Same, a positive result isn't always bad news. That gives you a lot of information, opens a lot of doors. So it's a lot of different things to work through for yourself and for all of those other family members.
I have a financial.
Okay, thanks.
Will this impact, so my boss is going to be changing our insurance providers, the insurance that I had when I had all of my surgeries, but does now that I have this diagnosis and I've had these preventative surgeries, will this impact my insurance costs, and will it impact like life insurance and all those types of things when you're, so I know a lot of people have said, don't take the test because once you get tested, then your insurance is going to be through the roof. And you can't get life insurance, and you can't, is that all true?
You can't get,
Is there a way to fight that?
you can't get life insurance. I can tell you, I've not been able to, and I've tried for 5 years. And your group policy, because you're going from group to group, you won't have a problem. And because now there's the law that you don't have pre-existing, so they can't deny you coverage as long as you go from group to group. But I can tell you, like a couple of the other girls right now, one of the others an ovarian cancer survivor can't get life insurance either. And now her daughter is trying to get it. And they asked, did her mom carry a genetic mutation in her dad? And you have to check yes, you can't say no. And sure enough, she was just denied life insurance, the girl at 21.
That feels like discrimination.
Let's go get the bill passed, Tammy. We got big mouths.
It doesn't feel like discrimination. Like,
In Florida, though, you guys do have a bill that just passed. It's House Bill 1139, I think. And that allows you to get life insurance, long-term care, and disability insurance without being discriminated against. They can still look at your health record though. So the discrimination is going to be, hey, I have BRCA2. They use that to code my prophylactic mastectomy. Now that they ask, or when they ask you when you went in for a preventative, or when you went in for your last hospital visit or whatever, and you say, oh, it was surgery, they'll see it in your health records. So I'm not sure how it works with that, but that bill is supposed to prevent
You know
the
who this
discrimination.
You know who this
1 second.
I do government affairs for a living, so I'm really interested in this, and I
saw it on the Force website.
Well, I'll look at it.
Yeah, I read it too somewhere recently on some other site too on Facebook. I'm not sure which one.
And there, oh, go ahead.
Allison?
No, that was it. I was just saying I saw it too. So I know it's out there somewhere.
We need to look into this because as of I was aware you weren't able to. So if I can get some life insurance, I think it's time. I have 2 little kids.
And there are differences state by state, and there are federal protections. So the main one that comes up for these is the Genetic Information Non-Discrimination Act, or GINA. That's the one that got passed in 2008.
What
and
was
so
it called?
GINA, G-I-N-A is the short one. And so that's protecting you from discrimination based on genetic test results and genetic information. So that includes your family information for health insurance and employment. There are some exceptions, so it does depend on how big your company is. So companies less than 15 employees are exempt from this. Things like active military are exempt. So there are some exceptions, but for most people, GINA would cover them for discrimination. But it doesn't specifically protect life insurance, long-term care, and disability insurance. So I've heard those 3 come up already. And that's where some states have stepped in and offer more protection on top of what GINA is able to protect people from. Like Florida, although that's news for me, but I don't always keep track of what's going on in Florida. And so it's helpful to find someone in your state who's familiar with these different laws and protections. Then it's also different if you've tested positive for a BRCA1 or 2 mutation and if you've had cancer. So they are able to look at your medical history for something like a cancer diagnosis, which would be treated differently than someone who's BRCA2 positive but has never had a cancer.
Okay.
I need to retract that. It's House Bill 1189, genetic information for insurance purposes.
Awesome. Thank you. I'm definitely
Yep.
And I haven't found one yet, but there's got to be a resource somewhere that tracks all of these states and who has the.
Yeah. I can track bills. I wasn't aware that there was a bill like this, and my boss is changing our insurance providers, and she was concerned. She's like, you have this gene. This is going to impact. I don't know. I still need insurance.
We still need and deserve insurance too.
Yeah.
The base thing. Again, I have more experience in Washington just because that's where I'm based, but I have had some people come back and tell me that when they went to apply for a life insurance policy, it didn't ask them about their family history or their genetic test results. So there have been some companies who just aren't asking, but I haven't had enough women come back and tell me their experiences to know if this is a age specific thing, if this is a county thing, if there's a certain life insurance group that's been more supportive or not. And I have had one person come back and tell me, so their mom was BRCA2 positive. They were tested negative for that familial mutation, and their life insurance policy actually dropped in price. So their life insurance policy looked at that and said, hey, you underwent appropriate testing and you're lower risk, and they were able to get a better plan. So to me, that's hopeful. It doesn't fit everybody that I meet with, but the life insurance policies are at least looking at the information and doing it more logically, or what would make sense to me, versus health insurance companies that don't always use things like general logic.
Yeah.
I can speak from my personal experience. Life insurance, I'm still trying to get up in Maryland, and that was one question I was asked is, did you have the gene? So I'm trying to get a bill passed up here for that. I do know other people in the area who have also been denied long-term care. So, and I got my testing through Myriad, and they never told me, hey, once you get the BRCA testing, it's going to be difficult for you to get the lifelong term care and disability insurance. So make sure you have that before you get tested.
Who in their 30s would think about that again?
Exactly.
Nobody.
No,
Well, very
that's
few
the
people.
problem is
That
these
should be on the fine print, I feel like, with Myriad and with all of these companies. They should tell us these things. Like, I just,
So I'm a big advocate for reading consent forms. At least back 10 years ago, it was in the consent forms, but you had to read it. And it's written at least I think we tracked it at a 15th grade, so college level or higher. And the Myriad one, at least now, is 2 pages, size 10 font that you would have to read. It's in most of the other labs' consent forms as well. But again, that assumes that you're actually reading a consent form, that you understand it. It's a lot easier to have someone face-to-face sit down and go, here's all the main things from the consent form. If you'd still like to read it, here's some time. I'll stop talking so you can actually read it, think about it, and ask me questions.
and I'll tell you, my genetic counselor, when I went through this, my primary care doctor said, you know, what's your history? Oh, I think you need to be tested for BRCA, and set me in a room with a phone. And then there was no person. I was sitting in a room and I was on the phone when the person told me my results. He wasn't even in the room with me. I was alone.
Wow.
It was like somebody was reading from a script. I asked like 3 or 4 questions. They gave me like an 800 number to call. And then I didn't see a genetic counselor again until I had my surgery, and she was with me for like 15 minutes. Like, she came in, she talked to me for a couple minutes. She asked like 3 or 4 questions that I already knew the answers to because I had already gone through some of the procedures, but nobody talked to me about age diagnosis for the kids, or about social workers to help with bills, or any of the things that you've talked about tonight. Nobody talked to me about anything about any, and I'm sure a lot of people can say the same thing. It was like they have to check a box. The genetic counselor has to come in before you have surgery and talk to you for a couple minutes, and then, okay, you can do it.
there's no standard of care, and that's the problem, like for the process of like
Genetic counseling, yeah.
genetic counseling, genetic testing. Like, I did my test again 2004, 16 years ago, right? I retested 4 years ago with color, and their process was like by far the most amazing process. I don't know if you work with them at all, but I work with Lily very closely, the head genetic counselor there. Like, they were absolutely fantastic. They called me right now. If I had a question, I can pick up the phone and I can call color, and a genetic counselor is going to call me back. Myriad doesn't offer that. Myriad didn't offer anything. They just gave you your test. I found out, I had to watch a VHS video. I found out my results, and that was it.
Well, and even Myriad does have genetic counselors who work there, and they do set up those relationships with some of the clinics, and I could do the same conversation for any labs. I'm not affiliated with any of them. I work with pretty much all of them at least all of them who are legitimate. The last year or two, we've seen a lot of pop-up genetic testing companies that are definitely not certified. They're not doing appropriate testing or billing for that matter. So I will throw that out. If your family members say they had testing done, try and get a copy of their results, because if it's someone like Color, Myriad, I'm definitely going to trust the results. I always hope the experience is fantastic like you had with Lily at Color, but that's not always the case, and there are other options out there. But it's something that should be offered to anybody undergoing genetic testing. It just doesn't always happen. And even myself, with my own history with my grandmother, I've been flagged for genetic counseling numerous times. It's partly how I test my healthcare providers, if they can see that that's what I do for a living. I've been referred to myself 3 times now. I'm like, you know, I understand what that is. I appreciate you making the referral. But I've also had genetic counseling myself that was a 2-minute video. I'm like, this is not genetic counseling. This is a soundbite. So I think it's important to and I hate to put the work back on people, but to speak up if you're not getting what you need. But it's hard to know you're not getting it if you don't know that it's out there.
Do you have like a white, I don't know what the white page is, like, you know, like this is what you should look for in a genetic counselor to make sure they're legitimate. These are the kind of questions they should be asking, like kind of a step-by-step, so that as we talk to other BRCA, you know, members of this group and our friends and family members, so that we know that these people are legitimate and how it gets covered by insurance. I mean, like really detailed as far as just getting the schedule and the testing, making sure your insurance will cover it, that you're working with a legitimate company, and that you have, who else has access to your results, like privacy information, because I don't know, the future is getting really weird.
I think that's something to come up with if they don't have it. I think that there's something that we can come up with, like an add to our marketing materials too, is like what you need to do. And, you know, like, no, we don't have a standard of care, but this is what the process you should have. Like, I think we could incorporate it in what we do now too, and then go back to, again, you know, listen, Julie did this and this is what we learned and this is the takeaway. I mean, listen, I know that I talk to women all the time, and I talk to women all the time, and I would love to be able to say, listen, everybody needs a genetic counselor. I definitely need to do that. Like, I would love to be able to say that to women. And, you know, again, yeah, me going through my experience with color was totally different. Cause again, you know, I said, you know what, I'm going to forget that I was diagnosed with myriad, and I'm going to go through the real process. And I got to feel the process. So for me, I think it would be helpful for us to educate and advocate other women, but to share, you know, how important it is, or let's blog about it, you know, like why women should see a genetic counselor. Like, if you are open to writing a blog, Julie, even, or Nikki, if you guys want to talk with somebody on your
amazing
team, like let's blast it. Let's get it. Like, we work with some of the Congress people here in South Florida. Tammy does too. Like, let's get it to them. Let's get it known. I'm willing to go to battle. I want to make a difference and help it for other women. You know, I know, Elizabeth, you're in another state, but like maybe we can come up with something for Maryland and Florida, and then find other women in every state to make it an easier process, to make sure that we're getting the resources that we need. Like, I want to add genetic counseling to a top of my tab of our website right now. Like, I'm sitting here thinking to myself, how did I ever not know that somebody could hold my hand through each stage of the process, knowing you need a skin exam, you need a GI, you need this, like we need all this stuff. And I know we spoke about GI tonight. We do have a call at the end of the month, which is on prevention of pancreatic, her specialty is prevention with GI. She's an oncologist. She's coming out at the end of the month, so you guys should make that call. It's super interesting.
I just want to say, like, as genetic counselors, like, I had to watch my mom die of cancer and then sit there on the phone in some like cold room with a complete stranger and just have them tell me a bunch of stuff I didn't understand. So just that there should be some standard of care, like she's saying, that it was very, and then you don't want to tell your family. It's like you feel like you caught some kind of like sexually transmitted disease. Like, it was just like a really weird experience. So I don't know. I'm happy to hear that you guys provide this service and all of that, because it's needed. It's really needed. And these bills and stuff that Elizabeth is working on, and some things that are happening here in Florida, like, we need to make sure that this is accessible to everybody, everywhere.
Well, and you know, at the very least, the genetic counselor should be certified. In some states, there's also licensure. So if you're in a state with that, they should be licensed. But just like any provider, there's a range of genetic counselors out there. So I think the blog would be helpful to kind of articulate this better, so you can say, like, okay, here's what I should expect versus here's what I got. And what I got is not what all of this was listed, or I just missed this one piece. That would be more helpful. There's ideal ways that genetic counseling should happen, and then there's ways that it happens in the real world, and those aren't always the same thing. I would say more often than not, they're not the same.
I would definitely be open to writing a blog and sharing it, like, or maybe you as a professional writing the blog and sharing it with us, and we can feature you in the foundation, like, to bring knowledge. And I know like between Twitter and LinkedIn and all of our social media platforms, like we can really make it happen and have other genetic counselors involved, you know, and let's help the community. You know, we've been through it, you know, but now what can we do for the next generation, especially for BRCA carriers? What can we do for their children to make sure that they go through the right processes? Because my 11-year-old in 10 years, pancreatic cancer is not going to be what it is today. You know, and every day there's a change. So what I'd like to do is kind of open up the floor just in case anybody hasn't spoken. If anybody has any questions, they can unmute themselves and ask any questions. I really appreciate you coming on tonight, Julie, and educating us and giving us more information. And let's make a difference, ladies. Let's make a change. You know, all we could do is keep fighting. I know every day I wake up and think of, you know, what can I do to make a difference in BRCA Strong? This kind of left me at an awe for tonight of what we can do to make sure this doesn't happen again to other women in the next generation. And I know a lot of us moms that are on the call fear what's going to happen for our kids. So anything I can do to make that happen, let's do it. We can get some people involved if we need to. But I really appreciate Nikki taking the time to even come on. You know, Nikki, I met her on Facebook, like she said, and, you know, I saw what she was doing. We spoke, and I'm thankful that you reached out. We reached out and were able to connect and make this call happen tonight. And I hope everybody leaves here with a piece of information that they can share with a family member or share for yourself to make your journey easier. And if there's anything we can ever do to help anybody, you can please let us know. For anybody that's new that was on tonight, that's either headed in for surgery, just diagnosed, or headed in for treatment, you can feel free to reach out to me, Tammy, or Kate, and we'd be more than happy to send you a care package in the mail and give you some basic information. And then maybe even, Nikki, before we end the call, what I'd like to say is maybe we can get some information